Growing concern tonight over the measles. A case in L.A. is now confirmed, and a death of a child in Texas, a school-aged child who was not vaccinated. It's the first death in the U.S. from this highly contagious disease since 2015. Ariel Wessler brings us the very latest. Ariel?
A disease once eradicated in the U.S., now health officials in Texas report at least 124 measles cases across 9 counties, the largest outbreak in Texas in nearly 30 years. Most of those affected are kids.
Around 2000, we eliminated measles from the United States, and now it's causing a resurgence because of the lack of vaccination.
Measles is a highly contagious airborne disease. According to the CDC, general symptoms include fever, cough, runny nose, red watery eyes, and most notably a rash, but it may not appear until 3 to 5 days after infection.
A kid with measles can walk into a classroom, and if that classroom's all unvaccinated children, 90% of them will get measles.
And he says the virus can hang in the air for up to 2 hours. Robert F. Kennedy Jr., the nation's top health official and vaccine skeptic, says the U.S. Department of Health and Human Services is closely monitoring the situation.
We are following the measles epidemic every day. We're watching it. We put out a post on it yesterday, and we're going to continue to follow it.
Vaccination rates have declined nationwide since the COVID-19 pandemic, and most states are below the 95% vaccination threshold for kindergartners. That's the level needed to protect communities against measles outbreaks. The MMR vaccine series is required for most kids before entering kindergarten.
This vaccine is one of our oldest and most effective. By the way, 97% effective.
Doctors say a simple blood test can determine whether you already have immunity. Last week, Secretary Kennedy vowed to investigate the childhood vaccine schedule for measles, polio, and other dangerous diseases, despite previous promises not to change it. Ariel Wessler, Spectrum News.